that shot.
It's mine.
No.
It's mine.
There's nothing to get on. I'm not gonna take it this session, so I'm trying to do this one. Oh. Do that otherwise you can't, so I'll just come out here.
Next month we'll be able to be back in the
Excited that I'm talking about.
Okay,
so we can
talk.
Going on tangents about nothing. Oh, okay. Parking lot.
Awesome, so I think we're gonna get started. I'd like to call this, no wait, I'm sorry, you're the chair.
Oh.
Not me, sorry. I thought I was the chair and then I realized actually we voted you as vice president this time. I apologize.
All right, let's see, I'll call this meeting to order. Could we have a roll call?
Danielle Chenoweth,
Here.
Kyle Patterson,
Here?
Andy Bornstrom. Okay, so we have a quorum.
Can I have a motion for the approval of the agenda and addenda?
So moved.
Second. Seeing no discussion, all those in favor say aye.
Aye.
Aye. Could I have a motion for the approval of the minutes from July 14th, 2022?
So moved.
Second. Seeing no discussion, all those in favor say aye.
Aye.
Aye. Public participation. Could we have
Hey guys, my name is Alex Kim. I am an undergraduate student at U of I, and this past summer I've been working as an EMT, and here I got to witness and treat a lot of different overdoses, and this sort of got me into harm reduction, and it made me think about ways to prevent this on campus, and it inspired me to start a program that educates the Greek community specifically, probably high-risk community for illicit drug use and overdoses. Some goals of mine are to give a presentation about narcotic overdoses and Narcan at the end, distribute it to them. And another thing I'd like to do is have a system in place to test the street drugs that are out there. Because a lot of times they're laced with MDMA, ketamine, fentanyl, etc. And having a system for that I think would be good. And I think my vision right now is to have accessible Narcan in the hands of all 90 Greek communities at U of I, and I'd love to work with you guys to make this a reality.
Okay, thank you.
Thank you. And right behind you is the guy to work with.
Yeah.
Quick question, do we know how you test for fentanyl in drugs?
Yep, so I am currently working with the Jolt Harm Reduction Program in the Peoria area, and what they do right now is they do testing strips, and I'm not certain exactly, but what they do is they grab a sample of the drug and then they use the strips and try and figure it out. And if it's inconclusive, they commonly send it to like a laboratory where they get additional testing done.
Do you know how expensive the strips are? I'm asking this because we have someone in the township orbit who just OD'd and died from fentanyl. And so I was trying to, it's like kind of a new area for me. I'm just curious if it's a do-it-yourself kind of thing where someone who purchases street drugs could test their own drug at an affordable rate. And it's curious if you knew.
I am not for certain about the cost and the thing.
Okay.
I'm seeing a very strong head nod behind you.
Chairman Kennedy.
A test strip is something that an individual can take and use to test their own drugs. I believe it's about $1 per strip, but don't quote me on that. I think that number is changing pretty rapidly.
How do you get access to that? Not meaning to take too much of our time on this, but just since it's here and it is forefront in our minds.
Yeah, you can purchase them online. The state is supposed to be sending us some, I'm told, sometime.
Okay.
So we did request 5,000 kits, fentanyl test strips from the state, and they should be sending them to us. I'm just not sure when.
Okay, I appreciate that. Thank you so much. Thanks for your efforts on this.
Awesome.
Thank you.
See no other public comment. Next is correspondence. Any correspondence?
There is no particular correspondence. If you want a brief update on monkeypox, we still currently have 3 cases. We're still working to make sure that everyone from the daycare-related case. Now, these were not exposures. I just want to clear that up. These were just potential exposures. So we're casting a wide net, and so far so good. So really
That's great news. And there's nothing under old business. New business is the treasurer's report. Did you have any comments?
At the end of June 2022, which was the fiscal end of year, we had cash on hand of $7.5 million. The total fund balance was just over $7.9 million, which is 45% of our budgeted expenditures, exceeding our 25% self-imposed guideline. We had a surplus at the end of the year of just over $1.5 million, and our annual budget was $17.7 million. So that's about an 8% of the total budget. Revenue was just under $15 million for the year, $2.1 million under year-to-date budget, mostly just all grants and contracts. That was the shortfall. Expenditures fell in line though at $13.3 million, which was 4.3 under our year-to-date budget.
Next, we have the approval of payment to Board of Health appointees. Could I have a motion for the approval of Ronald Field Treasurer for services rendered from July 2022 for $484.80. Check request number 4422.
Can we do it omnibus?
Yes. Yeah, let me just go through all of them.
Okay.
And then B is Ruth Wyman, attorney for legal services rendered from April 16, 2022 through May 15, 2022 for $25. Check request number 4335. Ruth Wyman, attorney for legal services rendered from May 15th, 2022 through June 15, 2022 for $600. Check request 4337. And D is Ruth Wyman, attorney for legal services rendered from June 16th, 2022 to July 15, 2022 for $375. Check request number 4338.
So moved.
Second. Any discussion? All right, seeing none, all those in favor say aye.
Aye.
Accounts payable invoices to be approved. Public Health Accreditation Board for annual accreditation service fee, Category 2 for $8,400. Check request number 4415.
So moved.
Second. All those in favor say aye.
Aye.
Aye. You have Pool Administrators Incorporated for outpatient ambulatory medical care provided from April 1st, 2022 through July 22nd, 2022. Invoices 202-20531, then 2022-0624, and 2022-072, for a total of $8,715.48. Check request number 4442.
So moved.
Second. All those in favor say aye.
Aye.
Next is review of July 2022 credit card statement. Is that something that requires approval?
I don't believe so.
Okay.
Any questions?
Okay.
Just if anybody had any questions.
All right. Next on the agenda is designation of the budget document for the fiscal year 23 tentative budget and appropriation ordinance 2022-0901. Is that something that requires approval or?
We're gonna put it on file.
Put it on file, so do we need
So
to?
for 30 days and then our next meeting, we approve.
So do we need to move that?
Yeah, I move to designate the budget document of fiscal year 23 tenant budget and appropriation ordinance.
So moved. Or second. Any discussion?
I'm gonna look at the budget in detail and I can send questions. I just, on the surface of it, just wanted to understand the net deficit of almost 5, although it sounds like we had a surplus from last year, so I'm just curious about the anticipated deficit.
We were actually planning on using, I forget it, I think it was like $1,447,400 for capital improvements.
Got it.
So that will come out of the fund balance.
I see. So the net deficit is mostly a capital improvements
Yes.
budget. Awesome. Okay, that was my only
Solar
question.
roof, hopefully.
Mm-hmm.
Solar?
Oh,
Mm-hmm.
do you you want me to say anything else, or you already have your information?
Oh, it's a long document, so I'll send you questions if I have it, but I read through the narrative portion, so I'm satisfied at this point to put it on file for the public.
All right, all those in favor say aye.
Aye.
Next, we have approval of fee structure following legislative changes regarding farmers market retail permits.
Is it, okay, I see approval, so moved.
Second, any discussion? Seeing none, all those in favor say aye.
Aye.
Aye. Approval of renewal of subscription of Baby Talk Incorporated data platform, an evidence-informed entity using aggregate data collected from affiliate programs to document impact and to inform curriculum development from July 1st, 2022 through June 30th, 2023 for a total of $2,000.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Approval of budgetary analysis and funding options for solar energy proposal for straight up solar.
So moved.
Second, any questions?
So basically, at this point, we're having straight up solar do an analysis and bring options back to us to look at what we're gonna fund. And we're basically budgeting a projected amount for that.
Yeah, and we've already had, Brandon's not here right now, he's the one that's heading this up. Did he give you any information about that? Okay, but we've had one already, so.
Oh, about
Yeah.
what analysis? Okay.
I believe so, or unless he's asking you to approve that one. So. Yeah, we're, we had the new roof put on, and that was the first step we had to do. And then we had to have people out to look, because apparently you just can't put those all over the roof. They have to, a bunch of engineering control things to look at, so they're doing that, looking at that type of thing, and then they'll tell us, how many you can have, and what it costs, and how much it takes time to recoup the money back, and that type of stuff, any
Yeah.
incentives, and.
We have a very good roof for solar, that's so big. So I think it's a great idea that anyone who's getting a new roof put on, that's a commercial building, should consider it, so totally supportive.
All
I think
right.
that made a motion, and you seconded that.
All those in favor say aye.
Aye.
Aye. Approval of addendum to lease agreement between CUPHD and Community Health Partnership of Illinois dated September 1st, 2021, raising the current rental rate of $1,578.50 per month by 10% to $1,736.35 per month, and adding $300 per month for janitorial services provided by CUPHD.
So moved.
Second, any discussion? All those in favor say aye.
Aye.
Aye. Approval of service agreement between CUPHD and Terabyte Holdings Incorporated, Consolidated Call Center Services, in which Consolidated Call Center Services will serve as first point of contact for CUPHD, for CUPHD customers 365 days per year, 24 hours a day, for $124 per month, for up to 120 minutes a month, with extra charges for additional minutes, fax, email service, and special reports for 1 year, beginning August 1st, 2022, after which it will be automatically renewed for month-to-month periods,
So
or for 1 month period, sorry. Second, any
Good question.
discussion?
Yeah, so is this a new service agreement, or do we already have this in place? Like if I call CUPHD, usually someone here answers, right? So this is a change to go to a call center approach?
Who did this come from?
I didn't do it, but yes, it's for after hours emergencies.
That's what I was wondering.
So it's
There's
just after
we-
hours, it's
yeah.
not during?
It's
the
sometimes during work hours if it's an emergency that's happening at that time, but it's normally for after hours.
Yeah, the way it's written, it looks like it, so basically, we, as a health department, we have to have any, certain issues reach us 24 hours a day, 365 days a year, so we just call it the call center.
Okay.
And then they call us after hours, they have a list of who to call based on what, and who to send the email and do the, or whatever. So that's what this is.
So this doesn't change that when a consumer calls CUPHD, a person from here answers the phone.
That's right.
Yeah.
Yeah.
Okay, I just want to make sure. 'cause
No,
that's
no, we're not
actually-
having people.
No.
It's a really great part of what we offer, and not all government offices offer that, and that can be frustrating.
Yeah.
Some have gone to this call center, so I had concerns about that. But
Yeah,
it's just
it's-
after
it's
hours,
After
to
hours.
redirect folks in emergencies, and, I mean,
Holidays,
the price
things
is
like that.
right.
Yeah, it is.
So,
If they were doing it all day long, taking just some of the calls alone, they would not be charged, they'd be charging us
Yeah, no, it was
$100
more
a
than like,
minute.
this doesn't make sense how they can do 24 hours
Yeah,
a day
no.
for customers to call you. Like,
It's basically after hours.
Okay,
and-
cool.
And so, yeah, there's it's a.
certain things they have to be able to escalate to you all.
Correct.
And, okay, after hours.
Yep.
Got it. Okay, my
All right.
motion stands.
All right, all those in favor say aye.
Aye.
Next is the approval of agreement between CUPHD and Presto X for commercial pest management services from August 1st, 2022 through July 31st, 2023 for $125 per month.
So moved, and also I
Second.
don't know how you got it that cheap.
I don't either. That
This is a
cheap.
very big building.
It's 99,000 square feet, I don't know.
Like, we pay
Maybe they're
half
only
of
doing
that for-
Candy's office, I don't know, we'll look into it.
She did say that's.
It's her first day
television.
back, leave her alone.
Candy's been on vacation, she just got back today, so.
You can pick on her.
Yes.
All right, all those in favor say aye.
Aye.
Aye. Approval of request for final payment for KEC Design Walk-In Cooler for use in CUPHD MCH Division for $20,457.80.
So moved.
Second.
It's gonna be awesome.
Any discussion?
Where is it?
All right, seeing none, all those in favor say aye.
Aye.
All right, the next meeting is, we're gonna be having the study session on the 31st.
Are we, Andy, did you have anything you needed to do for that?
I thought the Jody said we wasn't having one.
Andy asked us to have it at the end of September where we discuss.
Budget discussion?
Yeah.
Okay. All right.
So I just sent you on
Well, but we'll keep it on here, and if we need, we'll cancel it.
Okay, and then we have our monthly board meeting Monday, September 12th, 2022 at 4:30 here.
Right, and I think that by then we will be meeting in the main conference room again instead of this one. So-
Oh, okay.
Okay, perfect. All right,
So it can knock left the get that door went
all right, seeing no other business, closed meeting adjourned.
Right.
Oh, no, just kidding.
Pending grants.
Sorry, just the pending
Let's
grants,
get
this
something.
number's been on there, but there, it's
It's just this.
All right, do we need to approve this?
I think we approve these pending grants. We take a motion to approve the payment of Julie to make payments on those grants.
Okay.
Well, these are actually
Receive
grants
grants.
that come to us. Yeah, this is money that we get from grants, so that's something we're gonna talk about in the future, study session too. Like, you just want notice of these and not approve them, because I mean, the grants are coming in.
Okay.
It's not like you're gonna say, oh, wait, don't
Yeah,
take that
don't take that
$1,000.
Well,
Yeah.
it depends on if it's clean money or not.
All right, but, yeah, these are basically, as you can see, they're IDHS grants, so.
Okay, so just, do we need to pass these today?
I don't think you need to pass them. I don't think you need to pass them. We can talk to Rick about it, but you can just, we put them on notice so that they're in the minutes and stuff. so.
Okay.
But normally you do say, we have done that in the past where you just approve to sign them.
Uh-huh. Okay, so seeing no other business, I'll call this meeting